Could one small hospital spark a nationwide health revolution? I'm an ER doctor and I see the need for health systems transformation every day. Consider this future health system scenario number 66. A 43-year-old nurse administrator stood at the edge of her hospital's rooftop garden, watching families arrive not for emergencies, but for yoga classes, cooking workshops, and mental health circles. Just 5 years ago, this place was struggling with budget cuts, long wait times, and low staff morale. But something changed. The crisis was familiar: ballooning costs, burnout, preventable deaths. Nearly 90% of what affects health, like housing, food, and stress, was outside the hospital's walls. Yet most of the funding still poured into surgeries and scans. Leaders talked of innovation, but frontline workers saw little change. This hospital flipped the script. It began with one step: tying staff bonuses to local health outcomes, not patient volume. Could they reduce hypertension in the neighborhood? Increase high school graduation rates? Staff were skeptical but curious. The nurse administrator helped form a neighborhood health council. Barbers, teachers, teenagers, elders. Together they mapped root causes. Asthma rates? Moldy housing. ER visit for panic attacks? Job insecurity. Within months, the hospital started redirecting 15% of its budget, previously spent on administrative bloat, into community-rooted fixes. Doctors co-led a mold remediation program with local contractors. A midwife trained high schoolers as doulas and health advocates. Billing departments shrank while community health worker teams grew. Over time, specialists were retrained to work in cross-sector teams. Educators, city planners, and even artists collaborated to design health-promoting spaces. The changes were not instant, but they were deep. ER visits dropped 40%, life expectancy climbed by 7 years, and the model spread. 10 regional hospitals adopted similar measures. By year 10, state policy linked Medicaid reimbursements to thriving, not just treating. Beyond it all was the lesson of complex systems. True change emerges when relationships deepen, feedback loops are visible, and institutions evolve together. This hospital didn't just serve the community, it became part of it. This content was generated by AI. I want to highlight the need for transformational change and spark conversation in how we can reimagine a better future. I'd love your thoughts and feedback. Thank you.